Hello everyone, myself Barsha Roy and I am pursuing my Bachelor's of Physiotherapy degree from Marwari University, Rajkot. And in this video, we are going to discuss the physiotherapy precautions for cancer patients. So what are the contents we are going to see in this video? So first we will see some basic introduction to the cancer, then mechanism of cancer, how cancer occurs, then third, why physiotherapy precautions are important, and at the end we will start or move with the physiotherapy precautions for the cancer patient, which is the main topic of this lecture. So let's start with the introduction. Cancer is a disease in which abnormal cells grow and divide uncontrollably. These cells can invade nearby tissue and spread to other part of the body. That means this cells is dividing abnormally, and these cells having a capability to spread to other part of the body. Now, mechanism of cancer. How cancer occurs? So first, DNA mutation. Suppose this is a cell and it is having its own DNA, and this DNA having some nucleotide in which adenosine will bind with thymine and guanine will bind with cytosine. But in the place of thymine, uracil will be present and that will bind with adenosine. So this cell will lose its normal control, and after losing its normal control, this cell will divide abnormally, and this will form a solid mass which we call tumor, and this tumor has a capability to invade to other nearby tissue, and it can spread the cancer, and that process we call metastasis. Now, why physiotherapy precautions are important? So, cancer and its treatments that include chemotherapy, radiotherapy and surgery, which can affect blood, bones, joints, muscles, lymphatics, immune system. So that's why the physiotherapy should have some precautions to prevent the complications and to ensure the patient safety. Now let's start with our today's topic, that is physiotherapy precautions for cancer patients. So first one, the bone metastasis means bone cancer. If there is a cancer in any part of the body and that spreads to the bone, that is bone metastasis, cancer may spread to the bone making them weak. The risk will be fracture and severe pain. So precautions should be taken by the physiotherapists are like high impact exercises and heavy lifting and excessive spinal movement should be avoid because due to cancer the bones are already weak. So if we are providing heavy lifting or high impact exercises, that bone can be fractured more easily or pain can be there because the bone is already weak. Now second one, thrombocytopenia. This is a common symptoms or common thing with all the cancer patients. That is, thrombocytopenia means low platelet. Platelet is a very important component of blood which helps in the hemostasis process. And if this platelet level goes lower, then increased risk of bleeding will be there. So precautions should be taken by the therapist that vigorous activities should not be provided to the patient because vigorous activities can lead to injury, and due to the low platelet level the more blood loss will be there. Now third one is anemia, low hemoglobin level. Hemoglobin is an important component that carries oxygen, and due to low hemoglobin in the cancer patient it easily fatigue and weakness and breathlessness occurs. And physiotherapy precautions for anemia use low intensity exercises and provide the rest to the patient after each and 3 to 4 repetitions. Because the already hemoglobin level is less, so oxygen level is also less because the oxygen is unable to reach adequate amount of oxygen is unable to reach to the body part. That's why fatigue and weakness will be there. Now next one, neutropenia. That means white blood cells count is low, and the white blood cell, which is a major component which helps to fight against the infection. If this white blood cell count goes lower, then increased risk of infection will be there. So physiotherapy can take precautions that they should maintain the strict hygiene, and they should maintain strict hygiene, and that will help to reduce the risk of infection. Now, next one is lymphedema. Because of the treatment of like chemotherapy, like surgery, the swelling due to impaired lymphatic drainage can be occurred. So, physiotherapy precautions should be the affected limb should be avoided in the exercise part, and they should continuously monitor. And the last one, cancer-related fatigue. Cancer-related fatigue is the most common symptom in cancer patients. So, precautions, they should give the proper rest to the patient, and they should progress exercise gradually, not directly progress with each and every exercise. Then don't give that rest to the patient and you are continuously giving exercises to patient, that will be harmful for the patient. So this precaution should be taken by the physiotherapist. Now, conclusion, cancer causes uncontrolled cell growth and can affect multiple body systems. And understanding the cancer pathology and following the proper physiotherapy precautions for the that will help to improve the safety of the patient, and effective rehabilitation for the cancer patient can be given. And this is all about the physiotherapy precautions for cancer patient. Thank you.